Here we are with Jen Forman, who is an IT project management professional. How are you, ma'am?
I'm well. How are you?
Good. Thank you so much for joining us for this fireside chat. I think the first thing that I would love to know is how you got started in healthcare IT, because that's what we're talking about today.
Great. Well, thank you for that. I actually have a business degree from the University of Southern California, and healthcare IT was not anywhere on my radar when I first entered college. But I love technology. And when I started looking for jobs after I graduated, I came across a job working in IT at a plasma pharmaceutical company. And while the work wasn't glamorous by any means, as an entry-level IT person, the product that the company made was for hemophiliacs. And knowing that I was a part of a company that provided product and services that helped people in the healthcare realm, it was something that I really enjoyed, and I stuck with that.
Mm-hmm. Well, for a lot of people who maybe come out of college, and I was one of them, I had this perfect idea of what the perfect job was going to be, and I had a hard time adapting to anything else. So I ended up being in the career I wanted to be in, but the steps to get there were not what I expected, right? So I assume that being adaptable is key, especially when you do something like this.
Yeah, absolutely. And what healthcare IT means to people, it's different. Again, I started with a plasma pharmaceutical company, but healthcare IT can mean, insurance. It can mean clinical care in the hospital. It can mean artificial intelligence, teleradiology, remote services. It can mean so many different things. So when you say healthcare IT, it's such a broad topic. And when I decided to stay in the healthcare industry, I actually started on the insurance side of things, where you go see a doctor and you get a claim, and that claim gets paid. I then moved into more of the hospital side throughout my career. So being the whole spectrum of healthcare, it's very complex and very large. And so there's a lot of facets to it.
Yeah. So if someone is watching this and had not thought about healthcare IT, or knows someone who's moving into the IT arena and probably has not thought about healthcare IT, what are some of the things that you tell them to, or what advice would you give them, and what can they expect? Because I think that, again, maybe go into more detail about, what makes it so unique for you and what you love about your job.
Well, first of all, to kind of break a myth, you do not have to have a clinical background to be in healthcare IT. Obviously, that has its advantages, and there are times when you need to be a certified RN or physician or radiologist, for example, to be in a certain role. But just having the technology and the aptitude, you can be in healthcare IT. So if somebody's interested in getting into healthcare IT, they should, again, look at the areas that interest them. If you're interested because maybe you have a family member with cancer and you want to be in that side of the healthcare, go ahead and research that and find something in that arena that interests you. It might be providing care. It might be providing applications that help people get information or share information. It might be working for a company that's trying to develop drugs to help cure cancer. So it can mean a lot of different things, but find an area that you're interested in and go for that. Mm-hmm. When I moved to this community that I'm in, it's fairly small. I wanted to be a part of an organization that had a big impact. And so the healthcare organization here was an integrated healthcare hospital. And that was something to be a part of, where I could make a difference being a part of the organization in my local community.
Mm-hmm. Now, I know, and this may be stereotypical, but I do sense a lot of times women in their professions need that same feeling, usually, to be satisfied, to be fulfilled. Now, again, not saying that men don't need to have that same desire to serve a bigger purpose, but I think that women, because we're so emotionally based, that our emotions should be a factor in the jobs we seek, to know that it's okay to need that, right? And you found that with what you do.
Yep. And I've hired a lot of people over the course of my career, and many times these individuals were coming from, both men and women, were coming from a for-profit industry into a not-for-profit industry because they wanted to have that feeling and sense of giving back and use their skills that they learned in other industries in the healthcare industry because they actually are the same skills.
Right. I had mentioned to you off air, I am a kidney transplant recipient. And I've often said, now I had my issues when I was an adult and I was already in my profession. But I said, if I had this when I was younger, I would have definitely gone into healthcare because it's just, to me, the body is fascinating. And of course, I'm coming at it from a patient perspective.
Mhm.
But like you said, when you're working in any facet of it, including IT, you can have that satisfaction. Like you mentioned, someone who has a relative who is going through this. Or again, if you are a young child that had maybe had some healthcare issues, but you're more in the IT realm. Like, I don't want to be a doctor or a nurse or a technician. I'd rather do IT. You still, there is healthcare is an option. And again, I think that for a lot of people, they may not be considering that.
Yeah, and the IT side can be an enterprise system for financials or human resources. It could be billing, coding. There's things that are quote back office that can also that need IT support, analytics, quality data, integrations. There's so much opportunity in that healthcare IT. And what I've found being in this industry for 20 plus years is that where we were 20 years ago is so much different than where we are today. The When I first entered the industry, technology was maybe slower or behind, so to speak. But because of the introduction of wellness versus just taking care of somebody when they're sick, getting your wearables, your watches, your apps on your phone. Now
Mhm.
people want to take that information and show it to their doctor when they get into their
Right.
appointment. So now there's a huge push for technology, and the pace and the investment in technology in healthcare has picked up, which means people like me who are in IT doing project management are very busy and providing work that you can see the results, and it's super satisfying to be able to see how you drive by that building that now has you helped put the IT infrastructure in there. It
Right.
really is a satisfying place to be in IT and healthcare.
I think that's great. Well, now, of course, there's two sides to every coin. So, what are some of the obstacles, the challenges you may face if you decide to go into a career in healthcare IT?
Yeah, so from the experience of the individuals that I've hired, for example, that I mentioned that came from other industries, sometimes the pace of change is slower than they're used to. A lot of times we're not answering to shareholders because the organization might be not for profit. So sometimes those not for profit companies have to operate at a little bit slower pace. Another challenge that we have is that sometimes clinicians are not as receptive to uh, having a new technology introduced into their area. You know
Hmm.
what? I've always done it this way. This way works. Let's keep doing it this way. Or this piece of technology, this computer that is mounted over here requires that I turn my back away from the patient. And now I'm not having that interaction. And now the patient maybe feels neglected because I've turned to them because I have to use this electronic medical record system. And
Hmm.
so the challenges of change management, which is a whole other certification and beast on its own, is introducing the change and helping clinicians understand why the change and the benefit to the patient. And I shouldn't just pick on clinicians. It's also, it's everybody in the company, and actually it's not specific to healthcare. Change management is hard.
Well,
So.
it's funny you say that. I go to the pharmacy regularly because I'm on pharmaceuticals for my transplant. And just the other day, I went to refill a prescription, and this particular pharmacy had started an app where you could do the refills on the app, and it's very convenient for people, because it's convenient for patients like me, so that when I realize, oh, I need to make sure that I refill, instead of jotting it down, I need to call them. If I can't call them, I can just get on the app, press the refill, it's done, and I know that when I go in a couple days, it'll be there. Well, there was an issue where it wouldn't let me refill it. I went by, I said, "Hey, I just want to double check. Did this go through? Whatever." So they were hiring a second company to come in and fix that problem. And I remember the pharmacist being frustrated for two reasons. One, he felt like, I wish the person that was working on this was familiar with healthcare. So he mentioned that he didn't think the first company was, and specifically tried to find IT people who were healthcare IT people so that they could work on this app. And secondly, he's not the IT person. So, I'm sure you find, like you said, like a lot of people, I think, are intimidated by this industry and feel like, oh, it's your fault, fix it or whatever, and get intimidated by the whole process. So, there are many opportunities and so much technology that is coming into the healthcare industry that is going to revolutionize how we do healthcare. So there seems to be so much opportunity. But it's funny you say that this specific pharmacist, I'd forgotten he said that he needed someone who's familiar with this industry because he felt he could talk to them and communicate with them better than those who weren't.
Yeah, you bring up a great point. And I even put this in my notes, the ability to translate between those individuals, a clinical person who speaks pharmacy and somebody
Yep.
who speaks IT. And being in this project management role, we facilitate those conversations and make sure that we can say, okay, I know there's a lot of mumbo jumbo over here, but we're going to do this interface transaction that will help automatically put the patient data in your system so you don't have to type it in manually, and just make it be meaningful for them and understand in the level that they can understand it is a skill. It's a key skill, being able to translate that to a technical, to a non-technical person. But conversely, that clinician, that pharmacist may have terminology and words that we don't understand from an IT side that we have to then translate back. So it's constant learning, constant. And just when you think you've got it dialed in, a regulation changes from the government or some new product comes in, and suddenly you have to relearn a whole new set of acronyms. And the acronym list in healthcare it's unreal.
Well, look, I can't even pronounce the medicines I take, and I've been taking them for a long time. And again, I don't think Jen was expecting me to talk about me as the patient, but everything you bring up, it's like, oh, wait a second, I got another example. For those who are interested in healthcare IT, another thing that you do that saves lives. So it's not just that what you do is fulfilling, you save lives. So there's another aspect to my experience at the doctor's office. So, my doctors that are very technical and have a lot of technology surrounding their practice. One of the benefits of a doctor being technological is because of my transplant, I have to take a lot of immunosuppressant drugs. And one of those drugs does not play well with very many other medications. So anytime I get sick and need something, to help other symptoms, when they go into when they go to try to input that medicine for me, the computer will automatically say, this medicine doesn't play well with that one, so don't do it. So
Yep.
it's a case where a doctor, it saves time. They're in the office with me to let me know, okay, I can't do that. And we talk about it together. Okay, we can't do that because of this. So if a doctor didn't have that knowledge and tried to prescribe me something, then you would be putting my kidney at risk because the medicines would not,
Yep.
work together. So just for people who are not in the industry to understand, you are doing such a great service by working on these systems and understanding that, like you said, you are making a great difference in the lives of patients and doctors simply by doing what you do. And I don't think IT gets enough credit for that.
It is, like you said, it's so rewarding and satisfying, and the challenges are there, but I agree. And being able to use the tools or the systems that you create in your healthcare journey, it's an amazing thing. And when people, like I might have said before, when people are interested in entering healthcare IT and it says, healthcare experience required, don't let that deter you, because your experience is that you're a consumer of healthcare. We all are. And so, yeah, I don't have that job experience, but I have, like you, I have been in the healthcare industry using these tools and systems, and I want to make a difference and help, improve or make things more efficient in
Right.
healthcare. So
I
if
don't,
you're
I
interested,
I
go
mean,
for it.
maybe I can say that I have experience in healthcare. I don't know if I'm qualified, but I can try.
You
So to
do.
finish up our conversation, let's focus on women in healthcare IT. Is there a need?
Oh, absolutely. And I looked up some stats from, let's see, the Bureau, the Census Bureau, and some other areas. And you know what? Women predominantly are in healthcare. Like 76, 77% of healthcare employees are women. But a lot of those jobs are nursing and clinical side.
Mhm.
The percentage of people in leadership roles as women and IT is much smaller, and I don't have that number in front of me, but there is a need for women in technology because of, I mean, there's just the demand and having that connection to healthcare. And, women are predominantly, they are the healthcare decision makers and providers in their households. And so, what a great way to transition and connect your regular life with your job and career.
hmm Well,
So,
and that's why I think women in STEM leadership to me is so important. And told Jen this off air. I felt like, from a personal standpoint of my involvement is because you know, I I want women in IT to be encouraged, or who were interested in IT to be encouraged to come in, because there's a lot of women in the pool. There's need for more, but you're not alone. And I think sometimes there's this perception that there's not many women in IT, and we're here to change that. So, why, do you think that women in STEM leadership is so important as an organization?
I just like you said, having women with like-minded thoughts and goals coming together to achieve those goals, and having that hand on your back to support you and help you get to where you need to be. Offering mentorship and just having a, hey, I had this scenario happen. How would you have handled it? Let's talk about it. But again, like-minded women with a common goal of being in technology and promoting their careers to that is a wonderful thing. And that's why this organization is great to be a part of.
Awesome. Well, Jen, thank you so much. Jen Forman, I appreciate your time. We have up on the screen how you can contact Jen if you have any questions specific to this, but I appreciate your time and thank you so much for what you do.
You too. Thank you, Melissa.